Welcome, focused learners, to this explainer. Today, we're taking a truly fascinating journey through the digital transformation of modern medicine. We're going to start with this massive bird's-eye view of global health networks, and then we're going to zoom all the way down to the micro level, right down to the human interactivity happening at a single keyboard. So if you've ever wondered how healthcare is actually evolving in the digital age, you are absolutely in the right place.
Okay, let's dive right into this, because this question sits at the very heart of what we're looking at today. For centuries, medicine has been this highly traditional, very hands-on, human-centric practice. But over the last few decades, it has completely collided with the rapid expansion of the internet. And, this collision definitely creates some friction, but it also creates immense, completely unprecedented opportunities for global health.
So, here's our structural roadmap for today. First, we'll define the eHealth revolution. Second, we'll look at how it bridges geographic health divides. Third, we're examining the balance between doctors, machines, and autonomy. Fourth, the power of interactivity. And finally, navigating health information online.
Section 1. The eHealth revolution, the digital shift in medicine. And this brilliantly illustrates the concept. A lot of folks think eHealth is just, taking a paper chart and typing it into a computer database. But it's so much more profound than that. Technology, like a simple keystroke, is fundamentally an enabler. It's the gateway through which we can actually apply advanced medical sciences to expand the reach of health services. Technology is the bridge, it's not the final destination.
To really grasp this, we have to look at eHealth as a massive umbrella term. Yes, it's the intersection of medical informatics, public health, and business. But even more importantly, it's a state of mind. It's a way of thinking. It's a commitment to networked global thinking to improve healthcare locally, regionally, and worldwide. It's a total paradigm shift in how we approach both wellness and disease.
Section 2. Bridging Geographic Health Divides, Healthcare's Global Crises. To really understand why eHealth is so absolutely crucial, we have to look at the macro-level problems healthcare systems are facing globally. We're dealing with vast geographic distances, isolating rural communities. We've got rapidly aging populations. To put that in perspective, data projects that by 2041, about 23% of Canada's entire population will be over 65. Add a chronic shortage of healthcare professionals, complex language barriers, and skyrocketing chronic diseases, traditional healthcare models just can't stretch to cover those gaps. That's exactly where eHealth platforms serve as a vital bridge.
So, the huge takeaway here? eHealth is not about replacing your doctor with a robot. Not at all. It's about using technology to expand a doctor's reach, to assist them in managing diseases remotely, and to really enhance human activities, to fight those severe resource shortages we just talked about.
Section 3. Doctors, Machines, and Autonomy. The Human versus Machine Pendulum.
All right, let's zoom in now. We're moving from that global view straight into the hospital room, because there's a very real friction here. On one side, you have the traditional doctor knows best model. These professionals rely on decades of specialized training, peer review, and a deep sense of professional autonomy. On the flip side, you have the machine directives model, brought in by Clinical Decision Support Systems, or CDS. These systems automate diagnostics and direct workflows, so you can see the conflict, right? The system's rules can feel like they're overriding the physician's specialized knowledge.
The psychology behind this is just fascinating. Healthcare professionals are highly sensitive to their work environment. When a new CDS system gets introduced and starts dispensing treatment instructions, doctors naturally get anxious. They feel their exclusive authority is being encroached upon by an algorithm. They resist because, the computer acts as if it knows more than they do about their own patients.
Section 4. The Power of Interactivity, a Steak with No Knife.
Now, what's really interesting about this next point is how we solve that exact friction. And the answer is interactivity. Think of it like this. Introducing advanced medical tech without giving doctors interactive control is literally like giving someone a steak with no knife. It's incredibly frustrating and totally counterproductive. The system has to be cooperative. It can't just be a dictatorial machine barking orders at a trained physician.
The medical literature breaks this down into 3 levels. Level 1 is technology as an enabler, where it basically just generates data for the expert. Level 3 is technology as an operator, where the machine calls the shots and the doctor just supervises. And that's where autonomy feels the most threatened. But the sweet spot? That's level 2, technology as a partner. Here, the doctor and the tech dynamically interact and share equal weight in decision-making.
When a system acts as a partner, it boosts what researchers call perceived interactivity.
This means the system actually responds to customized needs through direct human-system interaction. And the result is kind of counterintuitive, but amazing. Higher levels of system interactivity actually give doctors more control. They can filter, review, and override suggestions, which completely reduces their anxiety and ensures the tech actually gets used.
Section 5. Navigating health information online. The patient's search.
Let's zoom all the way down to the micro level now, the individual patient sitting at home. For everyday users, just finding accurate health info is daunting. General search engines constantly fail patients because, let's face it, everyday users don't have a complex medical vocabulary. They type in a symptom and get back thousands of documents that are either way too complex or completely irrelevant. That creates a desperate need for highly structured health gateways that guide the user.
But there is a huge hurdle here: spelling. Medical terms are ridiculously hard to spell. Research shows that 80% of all spelling errors fall into just 4 categories. Take the word asthma. You might have a transposition, like swapping the H and T, an insertion, adding an extra M, a deletion, completely missing the H, or a replacement, swapping the M for an L. Without smart spell checking built directly into eHealth platforms, a patient looking for crucial info on asthma or Alzheimer's might get 0 results.
Check out this crazy stat from the research. 58% of these typographical errors happen simply because the user hit adjacent keys on the keyboard. It's a mechanical error, not a cognitive one, literally just fat-fingering the keyboard. This absolute reality of human error proves exactly why we need intelligent, forgiving medical databases that can catch these typos and suggest the right terminology. From bridging massive geographic divides globally to negotiating autonomy with physicians in the hospital room, all the way down to correcting a simple typo on a patient's keyboard, the eHealth ecosystem is vast. Which leaves us with a final, provocative thought. As these systems continue to get smarter, will technology ultimately replace the human touch in medicine, or will it simply perfect it? Thank you so much for joining me on this explainer, and definitely keep asking those big questions.